So with motivational interviewing is as the interviewer, I'm asking specific questions, not to tell you what to do, but to help you discover the answers within yourself. And so it's very deep because these are very specific and poignant questions.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold pressed juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. And welcome to Cold Press Conversations, proudly presented by Black Tie Legacy. Here we serve up a healthy blend of knowledge, insights, and inspiration, tailored specifically for health science educators just like yourself. Join us as we squeeze out the essence of expertise, delivering a refreshing dose of wisdom to invigorate your teaching journey. I am Dr. Jewel White Williams. We will be delving deeply into the world of research, instruction, and clinical practices. This is your space to learn from seasoned professionals who possess extensive experience and are eager to share insights and expertise. We believe that empowering educators just like you to elevate your teaching practices, we want to see you foster in a positive impact on your students' lives and shape your future of the health sciences as well as your community. Whether you're a seasoned veteran or just starting out your journey, I have something for you. So go ahead and grab your earbuds or your video. Let's settle in and get ready to elevate your journey as a health care educator. Today, I am extremely honored and pleased to announce our distinguished guest, Dr. April Renee Ruffin. Dr. April Ruffin is a shining example of dedication and passion in the medical profession. Graduating from Wright State University, Boonshoff School of Medicine in 2015, her journey began with a general surgery internship at Morehouse School of Medicine in Atlanta, Georgia. However, it was in internal medicine where her true calling was revealed, completing her internal medicine residency at the University of South Alabama in Mobile, Alabama in 2019. Dr. Ruffin demonstrated exceptional leadership skills throughout her residency. Dr. Ruffin's contributions to residents, wellness, and graduate education curriculum enhancements are commendable. Her involvement in the Resident Council and the Evidence-Based Practice Committee, can't wait to talk about that, led to evidence and significant improvements in resident well-being and impact community service initiatives. She also played a pivotal role in formulating strategies for positive changes in clinical practice as a part of an interdisciplinary team. She has embarked on her professional journey. She took the role of a hospitalist while also serving as an ICM preceptor for medical students and resident physicians. Her commitment to medical education and patient care are truly admirable. Beyond her responsibilities, she is deeply committed to addressing physical wellness as the founder of CEO of Renee Health, and she provides essential health education, speaker services, health coaching, and she also has an overarching goal to find enduring solutions to healthcare disparities within the community, striving to enhance community health on a holistic level. Let's welcome Dr. Renee Ruffin.
Hi, thanks for having me.
I'm very, very happy to have you. Very, very happy. And the thing about it is that this is going to be an exciting adventure today. As I stated, that I am just pleased to have you on here because with your background and all of your richness, I think this is going to be a phenomenal interview where people can gain insight, not just based off of just the health sciences field, but understand the bits and pieces. A lot of things that we don't talk about are the residencies and how you're
Mhm.
training. That's huge. That is a huge piece. So I do have my list of questions. I'm not going to lie to you, Miss Ruffin.
Okay,
Okay, Dr. Ruffin, I'm ready. I hope you're ready
bring
today.
it on.
So once again, this is Dr. April Ruffin. We'll be focusing on Healthful Horizon Screening, Community Care, and Mentorship Mastery. Tell us what allowed you to go into the field of why you're here. Like, what made you want to be a physician?
Yeah. So I was one of those people like early on in childhood. I enjoyed helping people and I wanted to be a doctor. And that was my thing. Like my parents would often tell a story of when I was actually in the hospital as a small child and how I saw another child in need, and they said that I rubbed her legs because she was in pain and told her, "You know what? When I grow up, I'm going to become a doctor and I'm going to make sure you have no pain." And so my parents always talk about that story, and they said, "Who is this like little small toddler-sized child doing? She's in the emergency room herself in the peds area, and she's over here comforting other children." And so my parents were just like, maybe she'll grow out of it. 'Cause a lot of kids when they're young, they say, "Oh, I want to be a firefighter or a police officer or a singer." And by the time they get 20 or 30, they've completely changed. It's completely different. But
Mhm.
I will say that I was always drawn to the
Mm.
sciences and the performing arts. So I knew that whatever I did in my life, it was going to be something that allowed me to actually be able to do both. And
Mm.
so I went to a STEM school, before they became a big, all the rage. I went
Yes.
to Boston Polytechnic Institute. And so I mean, the school was founded like in the 1800s, and they were really on to science and engineering. And so during that time, I knew that I still wanted to do science because I just love the intricacies of it. I liked how you can just discover new things, and it was always appealing to me. So I pursued a
Mm.
science major because I loved science. I mean, I fell in love with science. I tell people all the time, my third grade science teacher, Miss Gravenstein, she just inspired me. And I tell people all the time, she changed my life because I was that kid that was so shy, I wouldn't participate in class. And she was the teacher that gave me the space to, number one, find my voice, and number two, to express my creativity in ways in which
Mm.
I was unhinged in being able to be creative and pursue my desire for science. And so that mentorship and encouragement that she gave me was just it just kind of lit a fire in me. And so
Mm.
I was able to find my voice and find the things I like to do. And so I went on to college, NC State, um, and I continued to pursue that track, but I wasn't unafraid to still expand and see other things that I might be interested in. So when I was in high school, I got a taste of engineering. I realized early in my career that engineering wasn't really my thing. I even explored biomedical engineering. At that time, it was a newer field. And I actually looked at curriculums, from universities. I was that kind of student. I was that person because I wanted to see, like, were there other options or things that I could do that I could still go into an area that I still that where I could still be able to delve into the sciences that I enjoy. And so I looked at different curriculums and kind of look at different classes, and I decided, no, I still just really enjoy biology and chemistry. So I decided to be a biology major. And but I also loved history. So I minored in history, Africana studies actually. And
Oh.
people may think that's kind of odd, but it wasn't, because it got me a chance to understand other people and other contributors in the sciences, because many times in science we never learn about the black scientists that paved the way. And so I actually learned more about African Americans contributions to the sciences and the arts through my Africana studies. And it
Wow.
was actually at that point that through my Africana studies that I actually was able to solidify my desire to go into medicine. Just hearing about the different stories. I mean, learning about Vivian Thomas, and even though he wasn't a physician, he was
Yeah.
actually the technician that worked with Dr. Blaylock. They created the Blaylock Townsend shunt that we use even now today, and precipitated advancements of pediatric cardiothoracic surgery. And just
Mm.
knowing that story, I was like, you know what? I want to go. I want to do that. I want to be that thing. Like
Yes.
I want to just be like this amazing person that does these amazing things. So I
That's
created
interesting.
opportunities for myself. And so I just used what connections I had to create opportunities. I looked for internships to still say, is this what you want to do? So I just looked at
Mm,
internships. I did research at Hopkins. I made my own shadowing experiences. I spent time in DC with the National Women's Health Network, where I got to learn more about women's health and health policy. And we actually ran the health information service. So I got to understand how to relay evidence-based medicine presented in a layman's format so that lay people could understand what their health issues were. So if women were calling in and wanting more information about uh, different types of breast cancers, cervical cancers, education regarding menopause,
mhm,
and even early menses, to give education to individuals who wanted to educate other young women about, becoming a young woman and what that means from a physiologic standpoint. And so all those things just pointed to my calling to go into
mm.
medicine. And I do think that medicine is a calling. It's not something that you
Yes.
go into to make money. Because I tell people all the time, there's other things you can do that's less stressful and you can make more money than medicine.
You brought up a lot of good stuff in regards to it and how medicine works and
Hmm.
your trajectory of where you came. I'm gonna be honest with you. That vision that your mom had was just the precipice of what was going to happen. And that was
Hmm.
amazing to hear what you stated. So I want to circle back to something that you mentioned.
Hmm.
In a sense, even though you touched that young lady's leg,
Hmm.
you are already saying, I'm going to be that physician. I'm going to heal. I'm going to make sure you feel better. I'm going to take away that pain. I want to talk
Hmm.
about one thing. Can you share some insights? And this is a form of
Hmm.
education. And I want people to understand that we're talking about research, we're talking about instruction, we're talking about clinical
Hmm.
practice here at Cold Press Conversations. So we're going to touch about all three in this one particular question. Can you share some insights into the disparities in access to health screenings within the different communities and what strategies that you try to address these disparities through your clinical practices?
Yeah, so I mostly do inpatient medicine. That's 90% of what I do from a clinical standpoint. And, you know, when we went through the COVID pandemic,
Yes.
it really allowed people, even lay people, to see what I see, because people experienced what it felt like or what it really meant to not have access to care.
Mm,
Okay. And so what I mean by that is everything from getting access to their vaccinations,
mm,
getting access to the hospital, getting access to seeing a physician to care for them, getting access to the level of care that they needed, because we had patients who really should have been in the ICU that were
mm.
on the floors, right? So that was one of the first times I think a lot of people who may not have experienced it in a more overt setting
Yes.
got to really understand that we truly have these disparities. And so I see it by the time a patient comes to me in the hospital, I'm seeing the sequela of years of lack of access.
Mm,
So oftentimes you have individuals who, like in my standpoint, I'll see patients where they may not have had access to their standard immunizations, because as we get older, people think immunizations is just for kids. It's not. We still need immunizations as adults. So you see that where they're not getting access, and it's not just access to getting to the doctor, it's access to information, to
mm,
valid, credible information, access to even get the vaccinations or the healthcare screenings, because you have to first be able to, number one, break down the barrier of distrust. So when we talk about lack of access or health disparities, we have to first start with our history, right? And we have to recognize the medical apartheid that occurred here in the United States. And in order for us to really deeply understand health disparities, we have to understand the medical apartheid. We have to understand the distrust. So we have lack of access because initially we have to start with lack of trust because that has a historical basis. Then we have to have lack of access to credible information.
Mm.
The third is access to even getting to a physician. Okay. And so that
So
can be
true.
presented in different ways. It can be maybe I don't even know how to get an appointment to a primary care doctor. Maybe I don't even know what primary care doctors are in my area that can service me. Okay, so that's what I also mean by lack of access to the primary care doctor. Then you have transportation issues. How am I going to get to the doctor? And transportation is, also financial. Can I afford to even get my bus pass? Because
True.
I've taken care of patients who can't get to me when I was a resident in clinic because they don't have access to transportation. And
Mhm.
so you have to look at those issues. So you have money access issues as well. And then you also have to have access to physicians who are going to take in consideration what we like to call our social determinants of health. They like to come up with
Mm.
fancy words, but everything I mentioned is actually related to a social determinant
Det-
of health.
Thank you. Thank you for explaining that. Yes. So many people see, and then what they also trick us with are just the letters themselves, the acronym. So a lot of people are like, well, what in the world is this acronym meaning? How does it
Hmm.
relate to me? One thing that you mentioned, and I do want to say this, and I'm bringing it up because you're more than familiar with this, and you could
Hmm.
probably delve a little more into it. We're talking about the community health needs assessment.
Hmm.
And with the community health needs assessment, you literally stated some of the things that I just finished clicking on because it's going on about in our area that we're focusing on the needs that the community has and what are some of the lacks that are there
Hmm.
and what are some of the needs that we can have in order to assess what the community needs for further health. How can we
Hmm.
help them? And I think you just brought that up. It was really interesting also that you brought up the screenings collectively,
Hmm.
but when you talk about the screenings, I just want to go one step further.
Hmm.
When you are balancing the community, you're balancing the mentorship, the balancing
Hmm.
the community care, all that takes talent. And from what I gather, that you are a co-founder of Young Deb Incorporated, deeply involved
Hmm.
in mentoring youth.
Correct.
How does this particular mentorship contribute to the development of future healthcare professionals?
Hmm. Yeah, so one of the things is that we start early with our youth. So, in being a part of that organization, we recognize that we can't wait until students get to middle and high school to prepare them for life. Because
Mm,
what we find is that when we are looking at, when we look at certain standardized test scores, because we know that there are certain pivotal moments in childhood development that if you don't have these skills by
mm-hmm,
this time, the
mm-hmm,
likelihood of you developing and gaining those skills in adulthood is very slim.
mm.
And so we like to be able to expose students to what can be and in different formats. So that comes
Okay.
in a form of mentorship,
Okay.
that comes in the form of exposing them to cultural awareness. We've had students who
Mm.
had never been to the theater. Their first Broadway show was with Young Debs. Their first time to the
Wow.
symphony was with Young Debs. Their
So
first time
true.
out of Baltimore was with Young
Go ahead.
Debs.
Mm-hmm.
Okay,
Mm-hmm.
their first time seeing, for some, for seeing successful Black women in
Mm-hmm.
various professions.
Mm-hmm.
For many of them, it's the first time that they've seen, uh, you know, um, women in project management, women
Mm.
who are educators, women
Mm-hmm.
who are physicians, lawyers, entrepreneurs. And so they're getting a chance to see what can be. And
Excellent.
within that, we do a lot of education in terms of life skills because it's like, well, when you leave us, We want you to be able to, number one, feel comfortable in any space that you're in, whether
Mhm.
you're at a Ravens game rooting on
There
for
you
the
go.
Ravens, or whether you are at a White House press conference dinner.
Excellent.
You can flip from any scenario and you are prepared to hold any kind of conversation and
Yes.
understand the etiquette and cultural norms of the places where you are.
Mhm.
And so when you're walking into spaces, whether that be an interview, whether that be your first time on a college campus,
Mhm.
whether your first, real job where you actually have real responsibilities, you know how to conduct yourself. You know what to do. You know how to resolve conflicts. You can't tell mom or dad that you had an issue with your supervisor. You have to figure that out. You have to figure out, how am I
Yes.
going to navigate
Yes.
those professional spaces? Because what we
Yes.
find is, even now, as somebody who's had exposure to um, uh, undergraduate students and those wanting to matriculate onto professional schools, including
Mhm.
residents, many of them lack certain skills to actually know what it means to be a professional because no
Mhm.
one ever taught them.
Yes.
So it's nice to actually expose young people to what that means in different phases of their lives so that when they do get to the higher education and beyond, you're setting them up for success. I had my former chair of medicine said that when it comes to uh, education and resolving and helping to resolve health disparities, you can't
Yeah.
wait until the child is born. It starts
Mm.
preconception
Yes.
because we already know physiologically that a woman has to have those folic acid levels up, those certain vitamins and things, those levels need to be up because we
Mhm.
understand the first 2 weeks of development in utero before most women know they're even expecting a child, that neurodevelopment has already taken place. And if that woman is deficient, that can
Mhm.
have lifelong consequences. And so that's why my former chair always said that when it
Mm.
comes to resolving issues with education and our health disparities, we have to start preconception. And when you start preconception and you extend beyond, you understand the intersectionality among all of those things and how all of those things are related. So we must start early with our young people to actually help
Yes.
them to become healthy and successful adults.
Oh, yes. I love it. I love it. You know, we talked about yourself in the childhood, your
Mhm.
dreams, your aspirations, your education, how you're mentoring. I want to bring it all together. How do you
Mhm.
believe mentorship can be a leverage to encourage healthcare professionals to prioritize their own healthcare screenings?
Oh my goodness, that's a great question. And I would say because oftentimes as healers, we do not take care of ourselves. So
Mhm.
I think one of the most important things of mentorship is because it serves two functions. You have a psychosocial function and you have a career function. And so what you just spoke of speaks on that psychosocial function. This kind of takes on what we call those soft skills, having the empathy
Yes.
and being able to care for oneself and being able to grow as an individual personally. And so with mentorship, you get the opportunity, as a mentor, you get the opportunity to share your life experience to actually help guide others in various aspects of their lives, including self care.
Mm.
And as a mentee, you're able
Yes.
to utilize the experience of others to be able to help map out your life for yourself because mentorship is not, the mentor telling the mentee what to do. It's
It's
truly
changed. It's changed. Don't you
yeah,
think
it's
so?
really changed. It's a very dynamic thing. It's extremely
Right.
dynamic. And so it's a lot of give and take. We learn from each other, whether it be the mentor and the mentee. And so from, building the rapport, having that communication, being able to learn different skills, we
Mhm.
can learn from each other. And from that, we're able to craft a life for ourselves through mentorship. And as a result of that, we can encourage other individuals to be able to take care of their whole selves. And in order
Yes.
to do that, you have to take care of your physical, you have to take
Mm-hmm.
care of your mental, you have to take
Mm-hmm.
care of your spiritual, and you have to take care of your financial
Mm.
and your social. So
Yes.
all of those things you have to take care of. And so when you have good mentorship, you can be able to motivate others in various ways in those big five components that I just mentioned. And then with motivational interviewing, I use it a lot with my mentees.
Do you? Okay, good, good. Okay,
I
explain
do.
that. Explain that. That was
Mhm.
part of my doctorate. A lot of people have no idea what you just discussed. I'm not going to go any further, but I'm telling you, it's powerful. If you're in
It is.
education, it's powerful. Go ahead,
It
Dr.
is.
Ruffin. Explain that for those who are unfamiliar with that.
Yeah, so for motivational interviewing, it's kind of what people talk about, like a big thing now is coaching. So with motivational interviewing is I, as the interviewer, I'm asking specific questions, not to tell you what to do, but to help you discover the answers within yourself. And so it's very deep because these are very specific and poignant questions. And so through that interview process of the question answer session, we're able to work together to help the person on the opposite end be able to develop their own plan and to motivate themselves to actually create the plan for themselves, whatever that might be. So in healthcare,
Mhm.
for example,
Yes.
if I have, let's just say I have a patient, Mr. Smith, because Smith is a very popular name, last name.
Yes.
Let's say I have Mr. Smith, and Mr. Smith is coming to me, and Mr. Smith, he can get his medications. He'll go to the pharmacy and pick them up, but he won't take them. So when I also, he won't take them. He has
Yes.
diabetes. I'm like, okay, Mr. Smith, we're going to start with the metformin and maybe some glipizide,
Yes.
but he's still drinking 6 cans of soda every day. He has a case of cookies that eats at his nightstand. So I would be saying, Mr. Smith, okay, so I'll start with the question and say, okay, Mr. Smith, what do you hope to get from our meeting today?
Mhm.
With him and as my patient. And
Yes.
Mr. Smith will tell me what that is. I'll say, okay, Mr. Smith, well, I understand you like soda. Well, how do you think you can still enjoy your soda without drinking 6 sodas?
Hmm.
Right? And so
Hmm.
Mr. Smith will think about that. And they say, okay, well, I really like to have a soda with my dinner. Okay, well, do you think that we could maybe just say, okay, do you think you could consider drinking only 1 soda per day and just doing it with dinner? Do you think that's doable? And then Mr.
Hmm.
Smith will tell me that. So with my questions, Mr. Smith essentially developed his own plan.
Exactly.
And
Thank
he
you.
developed a plan for a goal that he knows will more likely be attainable for him. And then we regroup. And I'm not going to tell Mr. Smith, you need to only drink, 1 soda a day. And it's not going to work, right?
People are
Because
not
Mr. Smith
responsive to that.
he's not responsive. So I'm asking him
Yes.
questions to try to help him find a way for him to achieve a attainable goal. Number one, he's establishing a goal.
Yes.
And then through my questioning, he is actually the one that's developing the plan to get to the goal. And then we
Hmm.
regroup. So really that's what that is. And so and a lot of coaches use motivational interviewing and we can do it in different ways, but we also tend to ask very open-ended questions. And we do a lot of kind of talk back. And so we'll say, well, what I hear you saying is, and
Hmm.
then we'll
Hmm.
we'll give that summary, and then we'll usually will follow up with another question. And so it's a very powerful tool. We're taught this in medical school, but unfortunately, we almost never have the time to do it. Almost never.
We could go on with this because I think that's where the piece will come in for our community paramedics. or the physicians who are now going into the homes. It's been truly my pleasure. I hope you have enjoyed each and every bit of this, but it's been truly my pleasure having you on Cold Press Conversations. I think we did an exceptional job gaining so much insight as the audience of such a well-versed individual. Dr. Ruffin, you have such a toolbox that can offer to so many people in our communities. I hope that more people will take advantage of some of the suggestions that you've provided regarding healthcare screenings. We'll take advantage of how to work with our community and the care that we can offer to our communities, and the mentorship that you are doing from the youth all the way to those who are in medical school. You're making gains and strides in helping the community evolve. That's what you're doing. It's a form of mastery, and I say that not lightly. We have people called master teachers, and what you're doing is doing something of that nature. You're teaching at a mastery level where you're providing tools for people, not just information, but you're taking it to a metacognitive level where people are able to process it and hopefully entertain that and use it for their good. And I thank you. I thank you so much. Audience, I just want to say thank you once again for joining us on Cold Press Conversations. We are very delighted to have had Dr. April Ruffin. As always, she can be found on LinkedIn. I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.